Hello everyone and welcome to the last part on my series of the spinal cord tracks. This is part 12, episode 11. This is your friend Dr. Devesh Bhatt and let's get started with the new topic, Tabes Dorsalis. Syphilis is caused by a bacteria known as Treponema pallidum. And if this disease is left untreated, then the primary stage of the disease will be converted into secondary stage of the disease and then the tertiary stage of the disease. And in the tertiary stage of the disease, you might observe systemic manifestations like cardiovascular manifestations like aneurysm and aortitis, and also neurological manifestations like Tabes dorsalis. And as the name suggests, if you break the name Tabes dorsalis, you can think that there is something related with the dorsal column of the spinal cord. So let's look at the cut section of the spinal cord over here. This is the posterior side of the spinal cord, and this section that you see highlighted is nothing but your dorsal column tract. The tract that is present medially in dorsal column is your fasciculus gracilis, which is taking sensations from the lower limb towards your brain. And what kind of sensations we are talking about? We are talking about vibration, we are talking about proprioception, we are talking about stereognosis, we are talking about tactile stimulation and tactile discrimination. We are also talking about graphesthesia. All of these sensations from the lower limb will be carried by your fasciculus gracilis towards your brain, and the tract that is present laterally is known as fasciculus cuneatus, which is also taking all of these sensations but from the upper limb towards your brain. And all of this we have covered in our dorsal column tract, the ascending tracts of the spinal cord. Here in Tabes dorsalis, the axons of the dorsal column is affected, and hence all of these sensations will be affected. Another easier way you can remember all the signs and symptoms of Tabes dorsalis is by this mnemonic known as Tabes. T for tingling and lacinating pain, A is for Argyll Robertson Pupil, B is for balance, E is for exaggerated gait, and S is for sensory loss. What sensations? All of those which we discussed: vibration, proprioception, stereognosis, tactile stimulation, discrimination, graphesthesia. All of those. And let me also explain you what is Argyll Robertson Pupil, ARP. You can remember it as ARP. In a normal condition, in everyone, in all of us, if you are throwing light on your eye, your pupils will constrict to protect your eye, to protect your retina. All right, this is known as pupillary light reflex. So in Argyll Robertson pupil, the pupillary light reflex is absent. You can remember it as in ARP, PRA is absent, pupillary light reflex is absent, and in Argyll Robertson pupil, accommodation reflex is present. What is accommodation? When you are looking medially from both the eyes, if you are looking towards the nose, the part of your nose, this is known as accommodation. Your pupils, your eyes will accommodate, your pupils will constrict. So in ARP, in Argyll Robertson pupil, accommodation reflex will be present while the pupillary light reflex PRA will be absent. This is nothing but Argyll Robertson pupil, and these all are the features of your Tabes dorsalis, which is a manifestation, which is a late manifestation of your tertiary syphilis. Okay, and in the treatment you will give an antibiotic which is known as penicillin G. And I hope that's all for the video today. I hope you like this video. Like for more such video, and comment down if you have any questions or any queries or any topic you want me to cover. That's all for today. This is your friend Dr. Devesh Bhatt. Sukran, alvida, masalama, take care and do whatever you want, my lovely friends.